Hi, I'm Eileen Gavin. I am a school nurse from Middletown, New Jersey, and I'm coming to you today during this pandemic to just share with you a school nurse training for communicable disease management and investigation of COVID 19. As I said, I'm from Middletown, New Jersey, and I'm also the legislative chair for New Jersey State School Nurses Association. At the start of this COVID pandemic, towards the end of February, I developed a relationship with our local health officer as the virus unfolded in my community. And I quickly realized how overburdened the health department became. They had many cases as we moved into March, and they started recruiting township personnel to assist him with his communicable disease investigation. So I volunteered to help him out. While doing these investigations, I realized how this role was perfectly aligned with school nurse practice for public health, surveillance, education, and case management. I developed this training for 19 of our school nurses so that they can work collaboratively with the health department, and would like to share it with all school nurses in New Jersey and wherever, with the hopes that it will urge them to advocate for a role in their community, and partnership with their health department to help mitigate this virus. So, in New Jersey, we are fortunate to have a medical reserve corps. Many of our school nurses already have been part of this corps, and they're working on the front lines. They're doing COVID testing, they're manning phone lines, and performing communicable disease investigations. However, we've been asked through the health department to register and sign up, and many of us have. We haven't heard anything. And with the urgency and the need to address this timely, I developed the training at the county level, and I'm hoping that we could bring this forward as a grassroots training so that school nurses can get involved at the county level with their health department. So, as I said, we are they did, my health department did accept the training as part of New Jersey's Medical Reserve Corp as a just-in-time training. It's allowed when there is a emergency or a crisis, so health crisis. So it's not the formal training that everybody receives, but it's a just-in-time training, and it also allowed for us to sign the HIPAA consents that New Jersey Medical Reserve Corp signs. So we are working through the New Jersey Medical Reserve Corp. Anyway, New Jersey administrative codes are listed there. The 857 1.1 is gives the health department the right to do the communicable disease investigation, and 857 1.1 is giving them the right to order isolation and quarantine of those that are suspected of having a communicable disease or been in contact with someone that has had a communicable disease. So working through the county health department, and I always try to align everything I do with the 21st century school nurse practice. It really did fall perfectly in place, and really school nurses are positioned perfectly to see these investigations through and know what's going on in their community, really practice their public health principle of the 21st century practice. So we're going to start with just some basics. What's the difference between isolation and quarantine? And for me, the most simplest way of remembering it, as it says on the bottom, isolation is for those that are sick, that are COVID positive or symptomatic of COVID illness. Quarantine are for those that have been exposed to someone that is COVID positive. So quarantining and isolation can happen under the same roof in the same household. So it's sometimes difficult to manage, and we'll go through that. So the official definition of is isolation and quarantine help protect the public by preventing exposure to people who have or may have contagious disease. Again, isolation separates sick people with a contagious disease from people who are not sick. Quarantine separates and restricts the movement of people who are exposed to a contagious disease to see if they become sick. So This training is based on New Jersey Department of Health guidelines, and their guidelines for isolation recommends that any individual that tests positive for COVID goes into isolation. Close contact of those that have tested positive for COVID-19 also and are symptomatic should also go into isolation. And anyone symptomatic without testing should go into isolation. And minimum isolation is for 7 days, even though it's last on that little chart. They need to be 72 hours fever-free without any antipyretics, plus they have to have improved symptoms for those 3 days, significantly improved symptoms for those 3 days. And it has to be a minimum of 7 days has passed since the onset of symptoms and the feeling better and improved. So that those 7 days is the minimum amount. Those with a positive test without symptoms, which we have had, have a minimum isolation of 7 days from the time of the test. Asymptomatic close contacts. Asymptomatic close contacts can live in the same household as those that are isolated. So they self-quarantine at home and are monitored for health, monitor their health for fever, cough, shortness of breath, and other symptoms during the 14 days after their last exposure to the person that is testing positive for COVID or is symptomatic. They do not go to work, school, avoid public places during this time. If the person with COVID-19 lives in the home, they do their best to stay separate from that person and until their isolation is discontinued. So if they cannot separate, then they need to have continued contact. Say it's to parents and the children are asymptomatic. The children have to remain in self-quarantine for 14 days after the parents are past their isolation. The 7 days, the 72 hours asymptomatic, and the improving symptoms. So it's a long time. It's minimum of 21 days. It's very difficult to stress that to a family with small children. Again, asymptomatic close contacts must self-quarantine for 14 days from the last contact with an individual that tests positive for COVID. No exceptions. There's always those outliers that the virus will show up on the 14th day. So how do they isolate? They are living in a household where others are, and how do they isolate from others? So they need to separate from others, and it includes eliminating contact with people within their house, not traveling, not attending any public gatherings, not leaving the home except to seek medical care. And when they are seeking medical care, I do tell them to call ahead. If they're going to a doctor's office, let them know they're COVID positive. If they're calling an ambulance, let the 911 operator know they're COVID positive. Any contact with any emergency police, they should know beforehand that they're COVID positive so that they can protect themselves. They need to practice good hand hygiene, cleaning and disinfecting high-touch surfaces daily in the household common areas, which is like the kitchen and the living room. And the areas that need to be cleaned are tables, hardback chairs, doorknobs, light switches, remotes, handles, desks, toilets, sinks, and phones. They can live in a household and share a bathroom and share a common area with someone that is isolating, as long as the person that's isolating, when they use the bathroom is disinfected every time they use the bathroom. After every use, they disinfect that bathroom. And I recommend 1/3 of a cup of bleach to 1 gallon of water as a disinfectant in those areas. All the common areas need to be wiped down. If they go into the kitchen, everyone needs to social distance themselves from them as far away as possible, and they should wear some type of mask. If they don't have a mask, a scarf, a facial coverage as they go into the common areas. When they're in their rooms isolating, they do not need to wear the mask. So how do I quarantine from others? To quarantine from others, and both can be happening under one roof, so it's important that those that are isolated are isolated away from those that are quarantined. But those that are quarantined need to use standard hygiene and wash their hands frequently, not share things like towels and utensils. I recommend using paper plates and plastic utensils, and using paper towels in the bathroom or separate hand towels should they wash, that need to be washed every day. Staying at home, not having visitors, staying at least 6 feet away from other people in the household, because as they quarantine, some might become symptomatic and then need to go on isolation. So staying away from each other. There's not 6 feet between these two people in the window, but staying away from each other 6 feet, even in the household when they're quarantined, doing that social distancing. So here is our COVID investigation worksheet, and I will click on that in a second and just give you a quick view of what data we collect when we do the investigation and the information sheet that we use. But I also wanted to let you know that we have been doing this in Middletown remotely, and we use Google Voice. With Google Voice, you need a Gmail account. You sign up, they assign you a telephone number that you can leave on a message that they can call back and leave a voicemail. They do not get your personal phone number, the number that's left, and when you call in, it's identified with the Google number, not your personal cell phone, and you can block or screen any calls that come in. So it's a wonderful tool when you're working remotely. So I just wanted to make sure you knew that that was an option. That sometimes I know some people use the star 67, but that comes up as unknown caller, and a lot of times they won't pick that up, or it's rejected right away. With the Google Voice, it does usually accept that, and you can leave a voicemail with the phone number to call back. And I always leave the health department's phone number and contact as well when I leave a voicemail. So here is the COVID investigation sheet. The worksheet that we do, we were collecting a lot of data for the health department. They're looking for race, ethnicity, clinical symptoms, when it started, if they were hospitalized, if they died, if there's a pre-existing medical condition, what their symptoms were, when they started, were they in contact with someone that tested positive, if they work in any long-term care facility, if a close contact works in any long-term care facility, correction facility, homeless shelter, a community setting, and how many close contacts they have identified. And we review what close contacts are with the people that we contact. And close contacts are not someone that you meet in a supermarket in passing. It is someone that you have spent 10 minutes with, within 6 feet, and having a active conversation where the droplet pathway would be face to face, as opposed to someone working in the next cubicle or back to back. That would not be a close contact. So we ask them to kind of identify that as those that they've been in close contact with from 2 days before their symptoms started. We were initially looking at 3, but we're now down to 2. So this is the form. This is the flow chart that we put in front of us when we make the calls. I identify myself as a nurse working with the health department, and I'm going to perform a communicable disease investigation. Anyone that's tested positive for a communicable disease, the health department's notified. They usually will say, "Oh, you heard that I'm COVID positive." And I'll say, "Yes, you tested positive for COVID." Sometimes they haven't gotten the results. Sometimes it's performed in one of the drive-up facilities, and it came in quickly. Within 48 hours, we're seeing some of the testing, and we are telling them that they're COVID positive. Most of them are not surprised because they're symptomatic. That's why they went, or they've had an exposure, and that's why they went to get tested. So I tell them, okay, you tested positive, so what's next? They definitely need to isolate if they haven't already. And I tell them they need to isolate for 7 days until they have no further symptoms of fever, and that their symptoms have significantly improved for 72 hours without taking any antipyretics. And it has to be at least 7 days, minimum 7 days. So I tell them that I'm going to ask them, first I ask them if they're feeling up to a conversation, which takes about 10, 15 minutes, that I need to have a date of when the symptoms started. And we're going to look back 2 days and go through who they were in close contact with and how they're feeling now. What are their symptoms now and how they're feeling? They're usually, I would say 99% of them are very willing to talk. What those on isolation really appreciate having a resource to be able to ask questions to. They're very concerned and upset, and they don't want to upset their family members. They're terrified, that they're going to end up needing to be hospitalized, and how long should they be feeling this way? What are the signs where I should call an ambulance and go to the hospital? So they are very grateful for the call for the most part. So I start with, if you look at the right, the household contacts, it's each of these have a link. I'll start with what happens when you test positive. It brings you to the Department of Health's guidelines. These are all the look back documentation, but we're going to start over here with household contacts. Any household contact is considered a close contact and needs to start quarantining as soon as that test is positive. Hopefully they started quarantining when the person became symptomatic, but and isolated from that person. But this is the link for the recommendations for quarantining. So if they're symptomatic, but they haven't gone for a test, they're presumed that they're positive if they're in a household that an individual tested positive for COVID. So they need to isolate as similar to the one that tested positive for 7 days from the start of their symptoms, and 72 hours being afebrile without antipyretics and other symptoms improve. If they're not symptomatic, then if the close contact can truly isolate from the case, say they're living down the basement like Chris Como and using a separate bathroom and a separate kitchen, or they really are disinfecting and truly being on top of that and can say they really have done a good job as far as isolating, then they use the 14-day last contact. That person has to be on self-quarantine for 14 days. If they're not able to do this, to maintain that strict isolation, then it's 14 days from when the person is discharged from isolation. So this is tough because sometimes it's two parents and they're both COVID positive, but the child's not, and not showing signs. So it's very difficult to isolate a child from their parents. So they're kind of all together. Once the parents feel better and get past that 72-hour point and they're past that 7 days, that child then has to go into self-quarantine for 14 days after they're feeling better. So you're talking a long time for a child to remain in the house, 21 days or more. So it's really emphasized that they need to be watched. If they develop any symptoms, you need to reach out to your healthcare provider, and they need to isolate that child, and they're presumed positive as well. So the next one we're going to go to is close contacts not in the household. So as I described that before, that's when it's less than 6 feet for greater than 10 minutes and engaged in conversation. I tell them when everybody was out, I would say, having a meal with someone that maybe, if you're a police officer, those that stay in your if you're a police officer, your partner, where you drive around in the car, that would be someone that is a close contact. So if they're asymptomatic, again, they're on that 14-day from the last contact. If they're if they're symptomatic, they need to isolate as well, and 72 hours needs to pass so they have no fever, improving cough, no shortness of breath, and recommends that they contact their healthcare provider. The last box here on the right is do you work in a healthcare setting? So we have a lot of healthcare workers that are coming up as positive, and we need to make sure that their healthcare facility is aware that they are positive and that they put precautions as far as close contacts. They've been in contact with those that healthcare provider has been in contact with, that they sanitize the working facility and so on. And they need to contact their facility because every facility is different. Some of those close contacts are allowed to go to work until they start showing symptoms and they screen them. But as far as the person that tests positive and they're a healthcare provider, they need to follow the 72 hour rule as well as the 7-day being before they return to work. And it's recommended that they wear a mask until they're 14 days post symptoms, the onset of symptoms. And they also, if they stay out for 14 days, they don't need to wear a mask. But most of the healthcare facilities are making all their workers wear masks at this point. I also offer to email this document so they can read it themselves since they're healthcare providers. I provide that to them. So the only other highlighted area, the yellow box on the left-hand side, discharges from isolations for those tested. Some people have no symptoms and they're getting tested because their brother was positive or a family member was positive and they test positive. So they're discharged from isolation 7 days from the test. And if they are symptomatic, then they need to stay home for 7 days and isolate until symptoms improve and there's 72 hours afebrile without antipyretics or symptoms improve. So this is where it really came into play, where I realized school nurses really need to be part of this investigation and role. I end the conversation, sometimes it falls through the conversation as I do the history, that they have a history of depression and they might need some mental health services. And I give them New Jersey Mental Health Cares, which is open 7 days a week, 8 a.m. to 8 p.m. It was set up as this coronavirus kind of became more rampant in our communities. They're being told to self-quarantine, and a lot of people have food insecurities. They don't have the finances to pay for food or pay for bills. We've reached out to a lot of our community members to assist with that. We have the backpack crew delivering food, and we also have Middletown Helps Its Own as far as helping with food deliveries as well. We're giving them links for unemployment, and there's New Jersey job site with what jobs are available right now, offering documentation for those that are quarantined. They're not seeing healthcare providers. We're telling the health departments, telling them to quarantine, so they might need a note for their employer. I really encourage them to reach out to their healthcare provider. Most of the healthcare providers do follow up by telehealth, and they will check in with them every couple of days to make sure that their symptoms aren't progressing and they need any hospitalization or medication. So I do recommend that they reach out to them. If they don't have insurance, we've set them up with federally qualified healthcare centers, the FQHCs, and we've even set up some home care. I had a family of 4, multi-generational, and the older generation, she was in her 80s, ended up being hospitalized, and they weren't able to see her. They were managing everything by phone, and they were sick. They're not up to caring for her, and she needed to come home. And we managed to get some home care for her in their home. And the other thing we found out, we had a young family with a 7-month-old. All of them were positive, and they needed to get baby formula. And we were able to reach out to one of our resources in the community, and they had the formula delivered to their home. So keeping them in, because running out of baby formula, they're going to go out to the stores, and we really do need to keep them in. So this is like primary prevention and case management at its best for school nurses. So doing this, I realized this is like the first step of our reentry plan, because as school nurses and being involved with the health department, knowing what's going on, we really have our fingers on the pulse of the community. And we need to look at our relationship with the health department, because it's going to be really vital when we do re-enter into the schools. And I also want to bring up that this is definitely checks a lot of boxes for the 21st century school nurse practice. The communicable investigation and the plans for being involved in the reentry of school. So, as far as standard of practice, we need to look at our clinical guidelines for return to school, because we're going to have students that are quarantined, and we're going to have those that are positive, and we need to change our return to school from most. I know mostly everyone has a 24-hour symptom-free, no fever. Maybe we need to have that changed to 72. We need to follow evidence-based practice by the CDC in managing COVID illness in the school environment. Care coordination, case management. This is primary prevention at its best, really doing education at the household level, keeping the virus contained in the community, and hopefully decreasing hospitalization of our overburdened systems. Collaborative communication with the health department on reentry teams. We need to be a part of that, and school nurses need to ask about that now. There's going to be so much involved in getting the schools ready for reentry. As far as a health leader, we need to step up and have our voices heard. Motivational interviewing and counseling with the investigation. It really fine tunes your motivational interviewing and counseling. You never know what you're going to get on the other side of the line, and every bit of interviewing skills needs to come in place. You have to build a trusting relationship very quickly with that person. Leadership, models of practice and policy development for reentry and communicable disease control. System level leadership. We need to get on the county and I know New Jersey State School Nurses Association has been working with the Department of Health and saying we need a role in this return. So we need to reiterate the importance of school nurses as far as when they are ready to go back to school. When the staff and the students are ready to go back to school, school nurses need to be a leader in this. Quality improvement, documentation and data collection. We're doing data collection through the investigations, and community and public health. We're offering access to care, disease prevention, health education, outreach, population-based care, and surveillance at its best. So a lot of nurses have asked me about confidentiality and HIPAA and FERPA concerns. So during the pandemic, they actually loosened the what can be released as far as personal health information. And right now we are covered under the good faith uses, which allows for sharing of information for the purpose of preventing and controlling the spread of COVID. This is covered. We're allowed to share that information with the health department. The health department is allowed to share the information with us as well. So having that relationship before we get back to school is key. So I just want to end with really consider being involved at your county level and know what's going on in your community as far as the COVID virus and what your community needs, and get involved, ask to be part of the school reentry plan and have a voice and let it be heard. Because right now everyone's in the exit only, like that was the big plan, and no one's really thinking about reentry, but there's a lot of concerns as far as reentry, and nurses are the health experts. So we need to step up and be part of this plan. So I'm encouraging everyone that listened to me and took the time to listen to me to maybe reach out to your health department, maybe help them out as far as investigations and tell them that you've done this training and you can help out with investigations, and build those relationships and get on the planning for the reentry. I really encourage you so that all staff, students, and ourselves, school nurses, can enter back into a healthy school environment. Thank you for listening. You can contact me at egavin2@icloud.com or follow me on Twitter at nmnurseeileen. And thanks again. I appreciate your time.